I'm Peggy Peck, MedPage Today. Comparative effectiveness research is being promoted by many as the foundation for the cost savings that are needed to pay for health care reform being debated today in Congress. In that scenario, prostate cancer treatments have been held up as an ideal target for this approach. At a JAMA press conference in Chicago today, urologist Jim Hu explained how two approaches to prostatectomy, open retropubic radical prostatectomy and minimally invasive radical prostatectomy, can be compared on both cost and efficacy.
When we looked at the utilization rates of the competing approaches to radical prostatectomy, we see that the utilization of the minimally invasive approach increased from about 9% to 43% over our study period, with a corresponding decrease in the open approach. Looking at some of these outcomes, comparing the minimally invasive to the open approach now, we find that the length of stay for the minimally invasive approach was 1 day shorter than open, 2 versus 3 days. Men undergoing the minimally invasive approach were almost 1/10 less likely to receive a blood transfusion, 2.7% versus 20.8% for the open. In terms of 30-day complications, we found that the minimally invasive approach was associated with lower respiratory complications, which comprised pneumonia, pulmonary edema, pleural effusions, also a lower rate of miscellaneous surgical complications that are categorized as accidental lacerations or rectal injuries. However, the minimally invasive approach was more than 2 times more likely to be associated with genitorurinary complications compared to the open approach, which largely was comprised of urinary retention and may reflect, as seen earlier, the attempts at earlier catheter removal. In terms of the stricture rate, or the rate of scar tissue formation at the area of reconstruction, we see that the minimally invasive approach had a lower complication rate of strictures, 5.8 versus 14%. However, when we looked at the diagnosis of incontinence and erectile dysfunction beyond 18 months, or again, the period through which a plateau of recovery is expected to occur, we found that men undergoing minimally invasive versus open were more likely to have a diagnosis of incontinence, 15.9 versus 12.2%, and also erectile dysfunction, 26.8 versus 19.2%.
We asked Hu if his research led him to believe that robotic-assisted prostate surgery had in fact been oversold.
I think that's certainly the story that I would tell from our findings, in that the United States, as you know, is a unique setting, along with New Zealand being the only 2 countries in the world that allow direct-to-consumer advertising. And I think that in our healthcare system, perhaps a lot of hospitals, community hospitals, felt the need to be competitive with their tertiary referral center competitors, and therefore acquired these robots and marketed them before, for instance, there's been diffusion of experience to surgeons. And I think that's perhaps the result, why we found what we did.
So in this comparison, it appears that technology has outdistanced the evidence. I'm Peggy Peck, MedPage Today.